A few years ago, a mid-sized hospital system was drowning in cost overruns. They were using outdated equipment, bleeding funds on logistics, and struggling to expand patient access. Then they did something radical. They didn't cut jobs. They didn't reduce services. They focused on cost leadership, smart, strategic project cost management. Within 18 months, they cut $12 million from their operational budget and actually improved patient outcomes. That's the power of mastering cost in healthcare. Today, I'm going to show you what most healthcare leaders miss and how you can use cost leadership to transform results. If you stay to the end, I'll show you how to start mastering this skill today through my online course. There's a clinic in northern India that serves over 30,000 people in remote villages. Their costs were skyrocketing, mostly from poor procurement, inefficient scheduling, and storage losses. They were on the verge of shutting down. Then a new project manager came in and implemented a cost forecasting framework. They mapped procurement cycles, standardized service costing, improved vendor negotiations. In 6 months, they reduced costs by 37%, reopened evening services, and doubled patient volume. It wasn't a funding miracle. It was cost clarity. And it's the same system I break down in detail inside the course. In healthcare, the difference between thriving and barely surviving isn't just about funding, it's about how you manage what you have. Poor cost control leads to long patient wait times, drug shortages, staff burnout, project failure. But cost leadership leads to resource optimization, faster project delivery, better care outcomes, scalable systems. In every hospital, clinic, or health tech startup I've worked with, the most successful ones had a cost management mindset. Not just bean counting, but strategic visibility and action. Too many in the healthcare field believe cost leadership means cutting corners. But real cost leadership is not about denial, it's about design. Better supplier contracts, smarter inventory systems, leaner capital projects, cost-benefit analysis for every new initiative. We're not talking about spending less. We're talking about spending smarter. That's the new competitive advantage. Especially when the pressure to deliver more with less is only increasing. Every healthcare project, whether it's opening a clinic, launching a digital health platform, or upgrading imaging systems, follows a cost life cycle. Here's how smart organizations manage it. Planning, early-stage cost risk analysis. Budgeting, phase-wise budget breakdowns. Procurement, total life cycle cost comparisons. Execution, milestone tracking and cost burn rate. Closeout, post-implementation cost reviews. Whether you're running a large public health campaign or upgrading EMR software, these principles apply. Most cost overruns in healthcare projects don't come from emergencies or underfunding. They come from predictable, avoidable sources. Vendors overcharging due to poor benchmarking. Technology projects going beyond scope. Construction delays with no escalation clauses. Non-compliance fines due to documentation gaps. The systems to fix this exist. You just have to know how to implement them. And that's what our course teaches in detail. Here's what you'll walk away with in my full training course on cost management in healthcare. Project cost planning strategy, smart cost estimation, financial management strategies, cost monitoring and control, cost analysis and risk control. No fluff, just actionable, field-tested systems used by top healthcare project teams. You'll never run a project the same way again. This course is for you if you're a hospital administrator trying to stretch budget and improve care. You're managing capital projects in health infrastructure. You're launching or scaling a health tech product. You work in procurement and want to negotiate smarter. You're tired of reactive decisions and want strategic command.